Question number 24. What physician is performing here?
Removal of parathyroid glands.
How many?
3 parathyroid glands and part of 4th parathyroid gland.
Parathyroid gland. Now go for 60500, the code.
Parathyroidectomy or exploration of parathyroid.
Okay. Next one. Next code. 60505.
Parathyroidectomy or exploration of parathyroids with mediastinal exploration, sternal split or transthoracic approach.
Is the documented here transthoracic approach and all these things?
No, sir.
Next code.
Next 605 is 502. Parathyroidectomy or exploration of parathyroids, re-exploration.
Re-exploration means again he is doing for the second time.
No.
No. Then the code here is 60500. Next question number. Next question number.
30.
30. Yes, here. Herniated cervical disc, cervical laminotomy with partial fascectomy and excision for cervical. Yes, what is your answer?
B, sir.
63020. Everyone? Any doubts here in this question? Any doubts?
Sorry, C3 to C4 means one interspace.
One level, yes, one interspace.
Interspace is nothing but level, sir.
Yes. Interspace is nothing but one level.
Okay.
Any questions in question number 30? Any questions in question number 30? No? Okay. Next question number?
36.
36. What is your answer?
A, sir.
64721. Right side. Yes. A is the correct answer. Any questions here? Any questions from your end? Question number 36. Any question? Any questions? No? Yeah. Next question number.
Sir,
It's this. Yes.
1 second, sir.
Which question you are having now?
36, sir.
36. Yeah. What's your doubt here?
Sir, I got CRD.
See,
I didn't understand.
if you are going to read CRD, it is an arthroscopic procedure. Yes, sir. If you see here clearly, post-operative diagnosis, carpal tunnel syndrome, right wrist. That is the condition. Yes, sir. No? Now,
Yes, sir.
right. Here clearly they are stating right. It's RT. Wherever it is having LT, rule out that option. B and C we can rule out. B and C we can rule out. Yes or no? Then what are the options remaining for you? A and D based on the description. Now you can see patient was brought to the operating room, sedated by anesthesia. The patient bring to the operating room, they have given anesthesia. Then they are cleaning that area of the right hand, wrist and arm. Incision was infiltrated. That means they are providing anesthesia. After anesthesia, right hand, wrist was above distal arm. Incision was made on the close. Incision was made on the palmar aspect of the right wrist. Dissection was carried out through the skin and subcutaneous tissue. That means they are reaching towards the proper abnormality. Bleeding was controlled. The median nerve and its branches were identified, retracted and protected at all times. The ligament was incised from proximal to distal. A thorough decompression was carried out. A neurolysis was carried out. Neurolysis, nerve decompression. Where I said neuroplasty. Yes, sir. What is the nerve here they are doing? Median nerve. Where it is right wrist. Now you want to read the code description. 129848. What is the code description? Who have asked this question? Geeta Kumar, you? Your mic, I am getting disturbance. You can text me your answer. 29848 means what? It's an musculoskeletal system. Endoscopy related, yes or no? But there is no endoscopy here in that. That means arthroscopy in this question. Is that clear?
Yes, sir.
Okay. Next
Sir,
one.
neurolysis, neuroplasty, both are same terms.
Yes. Yesterday I said the key terms. Neurolysis, nerve decompression, nerve exploration, all comes under neuroplasty.
Oh, okay, sir.
Next question number
37.
37. 3 levels: lumbar, fluoroscopic, then bilateral, 644 by 3. B is the
Yes, sir. B is the answer. Sir, here modifier 50 is weight, sir. Why not
bilateral.
found?
Appendix A. Today I will discuss a few modifiers. Appendix A. Again, I said during
Okay,
when
sir.
we are discussing the CPT, there is a contents. In contents, you will get all the information what is available in the book. The first page of CPT book. Okay. B is the answer. Next question number.
No, sir. B for Bombay.
39.
Yes, B for Bombay Kalpana.
Yes, sir. Okay, sir.
Next question number 39.
39, sir. B for
39.
Bombay.
Yeah, 39. If you see, they are performing partial carpectomy to 3 vertebral thoracic vertebrae. 3 vertebrae. One surgeon performs, another surgeon 3. See here, 62 modifier you will get. What is the modifier?
62, sir.
B for Bombay is the answer.
No, okay, sir.
2 surgeons are involved. If you go with appendix A, I said already when we are discussing the CPT, starting contents is there in that appendix A, modifiers is there. If you go for appendix A, you will get all the modifiers description. Anyway, I will teach you today. 62 is for 2 surgeons performing the procedure. B for Bombay is the answer. Any other questions left? Any other questions left?
No, sir.
Okay. Now make heading eye and ear. Eye and ear. Eye and ear. First modifiers. Modifiers. First one LT. 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 Left side. Sometimes they may give LT modifier. LT modifier is used for left side. RT. RT. Right side. RT modifier is used for right side. Next 50. 50. Bilateral. 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 Next one 59. For distinct or different procedures. For distinct or different procedures. For distinct or different procedures. Distinct or different procedures. Alright. That means separate excision. Distinct or different procedures means separate excision. Separate excision. Separate incision. Separate incision. Separate excision. Separate incision. Separate body part. Separate body part. Separate body part. All is nothing but comes under 59 modifier. Distinct procedures. Now you can see here. Go for ear chapter. Ear chapter. Ear chapter. Page number 503. Page number 503. Are you there, everyone? Page number 503.
Yes, sir.
Okay. Try to recall anatomy of ear. What is the technical name for eardrum? What is the technical name for eardrum?
Myringo.
Tympano.
Another name for eardrum is tympanic membrane. We call it as tympano. Inner ear, what is the technical name? Inner ear.
Labyrintho.
Labyrintho.
Then ear. Ear.
Otto.
Otto. Sometimes auricle means
Auricle.
otto. This is the technical names of
Ear.
If you come across the anatomy of ear, outer ear, middle ear, inner ear. Outer ear, that means external ear, external auditory canal, cerumen. Then inner ear starts with eardrum, then eustachian tube adjacent to it, then three small bones, malleus, incus, stapes. These three fuse to form muscular chain, binds to oval window. This binds to inner ear, that is cochlea. From there, auditory nerves will carry sound impulses to brain. This is the anatomy of ear. Can you see here what are the possible procedures they can perform on ear? Can anyone tell me in the class how a ear can be formed, external ear? What are the body parts involved in formation of external ear? What are the body parts involved in formation of external ear?
Temporal and mandible.
Temporal and mandible. This process, what we call it as mastoid process.
Master.
Regarding anatomy, here no rules, just anatomy based chapter. We can see external ear, middle ear, inner ear. We discussed already the surgical terminology. Incision means what? Incision means, what is the technical name for incision? Write down if you want. Otomy. Otomy. Artificial hole creation means? Artificial hole creation means?
Ostomy.
Ostomy. Next one, excision means ectomy. Excision means ectomy. Removal or excision is nothing but ectomy. Repair means plasty. Repair means plasty. What are the technical names here? Incision, excision, removal, repair. There are only 3 body parts. Now you just mark the codes in your book. The common procedures that a physician can do in outpatient. Try to mark the codes 69100, 69105. 69100, 69125. What is that procedure performed here? Biopsy. 69100, 69105. Biopsy. Biopsy where they are performing, on external ear or auditory canal, that we need to look for. Next one, see the codes 69200, 205. 69200, 205. Just mark in your textbook. That's it. 69200, 205. Foreign body. Anything which is not ours that can be removed from a human body is nothing but a foreign body. For example, a small kid is there, placed slate pencil in the ear. Slate pencil in the ear. Physician is removing that slate pencil. He will write in the documentation as removal of slate pencil. But there is no code like that. Slate pencil is nothing but a foreign body. That means what the physician has removed? Foreign body. Anything which is not ours removed from a human body. What we call it as? Foreign body. 69200, 205. Next important codes you can mark 69209, 210. Cerumen, waxy substance which is present inside the ear, that is removed here. 69209, 210. 69209, 210. Next 69300. Surgical repair of ear, otoplasty. 69300. 69300. Next, come to the codes 69433, 69436. 69433, 69436. Tymphanostomy. Ostomy means what? Artificial hole creation on eardrum. What is the reason? For insertion of ventilating tube. What type of anesthesia they are using? Local anesthesia or general anesthesia? That is the difference between 69433 and 69436. We just mark those two codes. Next, come to the codes 69631. In that, underlining the code description, tympanoplasty without mastoidectomy. Tympanoplasty without mastoidectomy. Tympanoplasty without mastoidectomy. 69635. 69635. Tympanoplasty with mastoidotomy. Underline the key term, with mastoidotomy. Next, 69641. 69641. Tympanoplasty with mastoidectomy. With mastoidectomy. Busha, you are getting a question regarding tympanoplasty. What are the three key terms you need to look for?
Mastoidectomy, with mastoidectomy,
Mastoidotomy, without mastoidotomy or mastoidectomy. Next.
yes.
See the codes 69801. Labyrinthotomy. Labyrinthotomy. labyrinthotomy, and last code, important code 69930, cochlear device implantation. That means artificial device 69930. 69930. Now, as we discussed in anatomy, cochlea is filled with lymph, inner layers endolymph, outer layers perilymph. If that fluid is drained, for drainage purpose they will use shunt 69805 806. 69805 806. Now, which are the codes I make you mark? Just go through all the codes once, everyone, for 2 minutes. In this chapter, what are the codes I used to mark? Please go through all the codes. Read the codes for 5 minutes. Read everyone for 5 minutes. Any code that unable to understand, please let me know. If completed, just see question number 15 and 17. Go through the codes first, all the codes once, and then see question number 15 and 17. 15 and 17. No need to check with 99144, that is deleted. Just I am giving a hint for you. 15 and 17. Any doubts in that codes you can ask me. Yeah. Any doubts in the codes what you marked? Any code that I need to explain? Unable to understand the anatomy and terminology? Anyone in the class? Vishnu, Shobha, Priyan.
Sir, what is ostomy?
Ostomy means
Ostomy.
artificial hole. Making an artificial hole.
Okay, sir.
Anyone in the class? Susmita, Srilekha. See, if you're good in anatomy and terminology, maximum times without rules, you can go by the anatomy and terminology concepts. So what are the questions I have given for you? 15 and 15 and
17.
17. You can start doing 15 and 17. You can text me your answers who have completed. Make it fast. Only 2 questions I have given. Yeah. 15th question, what is your answer? 15th question, what's your answer?
D for Delhi, sir.
What is the code for Delhi? Tympanic membrane repair with or without site preparation of perforation for closure with or without patch. Yes, sir. This is the procedure done by the physician. 69610. D is the correct answer. They are using patch to repair the eardrum. Eardrum means what is the technical name? Tympanic membrane. Understood everyone? Fifth one, D for Delhi is the answer. Any other answers? Answers? Any other answers? Next, question number 17. Question number 17. What will be your answers? Question number 17.
B for Bombay, sir. Autoplasty bilateral.
Autoplasty bilateral. What is the code you are going to get? So when you read a code, you came to know. What are the codes? Bilateral autoplasty. Vishnu.
69300.
69300. 50 modifier. Yes or no? For bilateral,
50 modifier.
what is the modifier? 50 modifier. B for Bombay is the
50
answer.
modifier.
B for Bombay is the answer. Do one more question. Then we will go for I chapter. See what happened to others. Are you doing or not? I don't know. Please let me know if you are having doubts. I will explain. Now, question number 29 and 30. 29 and 30. We will close this session here. Then we will move into I. 29 to 30. 29 and 30. Both the questions. Take 5 minutes time. Very easy if you understand the anatomy and terminology. 29 and 30.
Mohan, that autoplasty is done under conscious sedation, so we need to code separately conscious sedation.
If time is documented, then you can code separately. Minimum time
Okay.
required to code sedation is 10 minutes.
Okay. So in that case, it won't be required then.
Yeah. Right now, there's no required.
Sir, can you please repeat question number 29 and
30.
30.
30.
Okay, sir.
See, try to understand the anatomy and terminology and what is the abnormality. You will get the code. Try to map the code description is the procedure performed. That's it, coding. As a coder, we don't have any practical knowledge. We always believe on key terms. See, completed everyone. Question number 29. What will be your answer? Question number 29.
D for Delhi, sir.
For Delhi, everyone.
C, no, sir.
D. 69436. They are using general anesthesia, right? Read the code.
Yes, sir.
General anesthesia means what is the code?
Yeah. 6964, sir.
Next, question number 30. D is the answer 29. Question number 30.
C, sir.
C, sir.
C, everyone. 69420. C or D, based on ICD you can rule out. 69420 is the CPT. Everyone, any questions here? See, if you understand anatomy terminology, then ear related questions you can do easily. 69420. Okay. Next, eye related questions. Eye chapter. Any doubt in that question? 69420? No? Okay. Go for eye chapter. Eye chapter. Eye chapter. Now try to recall the anatomy of eye. What is the anatomy of eye? Where is eyeball located? Can anyone in the class? Can anyone recall the anatomy of eye?
In a bony socket.
Orbit. Yes or no? Eyeball located in orbit, a bony socket. Eyeball externally covered with muscles. What we call it as extraocular muscles. What are the muscle names? Rectus muscle, oblique muscles. These are the muscles which is surrounding the eyeball. Then lacrimal sac, which is present at eyeball, which is involved in formation of tears. Then eyeball divides into two segments, anterior segment, posterior segment. The total eyeball is covered by a layer, what we call it as sclera. Then anterior segment. What are the body parts? You can see here. See the diagrammatic representation on the page number 486. Page number 486. You can, what are the body parts present in anterior segment? Cornea. Adjacent to cornea, conjunctiva. After cornea, anterior chamber, iris, pupil, lens, ciliary body. These are all parts present in anterior segment. What comes under posterior segment? Vitreous chamber, retina, choroid. In retina, optical disc. These are all present in posterior segment. Just check your anatomy. Then eye means ophthalmo, oculo. This eyeball is externally protected by eyelid. Eyelid, what is the technical name? Blepharo. These are the technical names of anatomy of eye. Again, I am repeating. Eyeball, where it is located, bony socket, what we call it as orbit. This eyeball can we move from left to right, right to left, up, down because of extraocular muscles, medial rectus muscles and oblique muscles. Then lacrimal sac, which is involved in formation of tears. Then externally curved protected by eyelids. Eyelid technical name is blepharo. Eyeball technical name is ophthalmo, oculo. Eyeball divides into two segments, anterior segment, posterior segment. Anterior segment, posterior segment, eyeball is totally covered with a white layer, what we call it as sclera. Anterior sclera, posterior sclera. What are the parts of anterior segment? Cornea, conjunctiva, anterior chamber, iris, pupil, lens, up to lens, the parts present in anterior segment. Posterior segment, vitreous chamber, retina, choroid. These are the parts present in posterior segment. And this is the anatomy of eyeball. In retina, you will find fovea of centralis optical disc. You can see the diagrammatic representation in page number 486. Diagrammatic representation in page number 486.
Yes, sir.
Understood everyone? The parts and everything. Now try to see the codes. Mark the codes. 65101. Enucleation means removal of eyeball. 65101. Enucleation means removal of eyeball. Next, 65205. 65205 to 65222. 65205 to 65222. Removal of foreign body. 65205 to 65222. Next, try to mark the codes. 65710 to 65750. Kerato means cornea. 65710. Phakia means lens. 65710 to 65750. Kerato means cornea. Phakia means lens. Just note down if you want the 65710 to 65750. Next, come to the codes. 66982. Page number 492. 66982. 982 to 985. 982 to 985. 66982 to 985.
Sir, kerato means cornea.
Yes. Kerato means cornea.
Pha-
Phakia,
Phakia means
lens. Lens means phakia. Come to code 66982. Try to underline in the code devices. This is cataract removal procedure. What they will use? Complex procedure. Try to underline in the fourth line complex with the help of device. Iris expansion device. Cataract removal with the help of device. 66984 the same procedure without devices. 982 and 984 the difference is with the help of device, without device. 982, 984 with the help of device, without device. Nine eight five only insertion of lens. 985 only insertion of lens. Only insertion of lens. Only insertion of lens. Insertion of lens. Next, come to the quotes. You can see the page number 495 diagrammatic representation regarding muscles. By seeing the diagrammatic representation, can you tell me what are the names of horizontal muscles? Page number 495. Can anyone tell me what are horizontal muscles in the diagram? Horizontal.
Lateral rectus muscle, medial rectus muscle,
What are vertical muscles?
superior rectus muscle, inferior rectus muscle.
Now, you can see in the quotes here the procedure performed is strabismus surgery. They will give you the muscle name in the question. You need to identify it's an horizontal muscle or vertical muscle. See the code 67311, 312, 314, 316 like that. Strabismus surgery. They will give you the muscle name. You need to identify whether it's a horizontal muscle or vertical muscle. Just note down that based on horizontal or vertical muscles. Horizontal or vertical muscles. Next, come to the codes 679142924, 679142924, 679142924. Here, we need to identify the eyelids. You can see the diagrammatic representation on the screen. How many eyelids we are having? How many eyelids we are having?
2 pairs.
Of eyelids. Now you can see. This is, you can say, right side. This eyelid you can say left side. Eyelid, the first letter is E, E1. This modifier given as E1 to left upper eyelid. E2. E3 for right upper eyelid. E4 for right over eyelid. Now try to mark this diagram there itself. This entropian ectropian concept is based on eyelid. Where is the procedure performed? Left upper eyelid, left lower eyelid, right upper eyelid, right lower eyelid. Left upper eyelid E1, left lower eyelid E2, right upper eyelid E3, right lower eyelid E4, like that. E1, E2, E3, E4. Understood everyone? Ectropian means outer side. Entropian means moving eyelid inner side. Now can you tell me what is the modifier used for right lower eyelid? What is the modifier used for right lower eyelid?
E4, sir.
E4. Left upper eyelid?
E2.
E2. Now try to see the question. Question number 32. 32 and 33. 32 and 33. 32 and 33. 32. A patient presents to the emergency room with a severely damaged eye. Try to underline severely damaged eye. The injury was sustained when the patient was a passenger in a multi-car accident on the public highway. The patient sustained a large open lacerated wound to the left eye. The posterior chamber was ruptured and significant vitreous and some intraocular tissue was lost. The eyeball was not repairable and so was removed en masse. A permanent implant was inserted but not attached to the extraocular muscle. The patient was released with an occlusive eye patch. First point. Is this a sequela or subsequent encounter or initial encounter?
Initial encounter.
There are multiple ways to rule out an option. Is this a sequela, or initial encounter, or multiple subsequent encounter? Anyone in the class?
Initial encounter.
Initial encounter. Can we rule out option A and D without seeing the quotes? How? Why? Because the seventh character is S, the seventh character is D. See, this type of approach you need to do in the examination. Seventh character is S, seventh character is D. Then what are the remaining options with you? What are the remaining options with you if you ruled out
B
A,
and C.
B and C? Then it is very easy to look after two quotes to rule out the options. Understood, everyone? How I am ruling out the options? See, every question carries only 2 minutes. If you go by each and every code, it will become difficult for you. There is a method that at least two options can be ruled out. Always we need to focus on how to rule out the options. A and D can be ruled out, then B or C, then check with the code description 65103 093.
Option C, sir.
65103
Option A, sir. Option no, sir.
65093.
Six five one zero three. Evisceration of ocular contents. 65093. Evisceration of ocular contents with implant. What are the two options? 65103, 65093. Enucleation of eye with implant. Muscles not attached. Now tell me. Read the question and tell me.
65103.
103 is the correct answer. C. Enucleation. I said removal of eyeball. And they are not attached the muscles to the eyeball, but they placed the implant. When you read the question, you got all this information or not? They removed the eyeball, then they placed an implant, but they are not attached to the muscles. Anyone from 65093? Anyone from 65093? Why you people coded 65093? Can you explain? Anyone who have coded? Understood what I am saying? What is the correct answer here? 65103. B is the answer. Now do question number 33.
Sir,
Yes.
here evisceration means what, sir?
It is also removal, but ocular content means extraocular muscles, not the removal of eyeball. They are not removing the
Okay,
eyeball,
sir.
they are removing only the extraocular contents. Extraocular means what? Outside the eyeball.
Yes, sir.
Question number 33.
Yes, sir. 67145.
Okay. Any other answers? Any other answers? Try to focus with the key terms that in the question and the key terms in the code description. Always focus as a coder. Try to underline the key terms. In the procedure, they will clearly document the key term.
Six seven one four five, sir.
67145. Any other answers? Any other answers? Any other answers? Any other answers? No? Okay. By this, you can practice 60,000 series. That means in 60,000 series, what are the topics we came across? Nervous system, then endocrine system, eye and ear. These 4 topics comes under 60,000 series. What are the topics comes under 60,000 series? Endocrine system, nervous system, eye and ear. Understood everyone? Now make heading digestive system. Digestive system is this.
Sir, evisceration means removal, and enucleation means what, sir?
Enucleation means removal of eyeball. Of eyeball.
And exenteration?
Sorry?
Exenteration.
Exenteration. Exenteration means
Exenteration of orbit.
that is one second. I will see. See, exenteration means from the orbit all the muscles, nerves, everything can be removed during exenteration. Muscles, fat, nerves, eyelids, everything. The diseased total part they will remove, including eyelid. Okay.
Okay, sir.
Next, what is the another one you asked me? Evisceration, right?
Yes, sir. Evisceration and enucleation.
Enucleation means removal of eyeball. Intraocular contents or extraocular contents that are removed is nothing but evisceration. Extraocular muscles. If that is removed, then you can say it as evisceration. Enucleation means removal of eyeball.
Removal of eyeball?
That is enucleation.
Yes.
Okay. Now make heading digestive system. Now just listen. I will recall the anatomy of terminology of digestive system. See, what are the technical names that we got come across regarding digestive system? Stomach means gastro. Small intestine means
Entero.
large intestine means
Colon.
rectum and anus. Rectum and anus, procto. Liver, hepato. Gallbladder, cholecysto. Gallbladder,
Cholecysto.
next, mouth, Mouth,
Oro.
orocolon, stomach. Next, teeth, denti, gums, gingiva, lips, halo, labio, tongue, glasso. Then
Lasso.
these are the terms, abdomen, leparo. These are the terms we came across regarding digestive system. Yes or no? Now, if you check with the anatomy of digestive system, starts with mouth, then esophagus, stomach, intestine, rectum, and anus. The accessory parts of digestive system is liver, gallbladder, and pancreas. Yes sir. Now go for 40,000 series in your CPT book. Digestive system. Digestive system. Are you able to see the diagrammatic representation? Digestive system. It is in your book, page number 332. 332. You can see the diagrammatic representation. Now for today, you just note down the difference between endoscopy, open and laparoscopy. Just note down. Difference between endoscopy, laparoscopy and open. Difference between endoscopy, laparoscopy and open. Now first write down endoscopy. Endoscopy. Endo means within. Endo means within. Scopy means examination. Endo means within. Scopy means examination. Endo means within. Scopy means examination. Next point. Scope means an instrument used to examine a body part. Scope means an instrument used to examine a body part. An instrument used to examine a body part. Next point. The scope is of two types. Scope is of two types, rigid and flexible. Rigid scope, flexible scope. Scope is of two types, rigid and flexible. Next point. Route of approach. Route of approach. Route of approach. In two ways. Route of approach is in two ways. First one, natural opening. Natural opening. Second one, artificial opening. Natural opening. Second one, artificial opening. Now, if I said you are going to do an endoscopy procedure, what are the three parameters we need to look after? What are the three parameters we need to look after? By reading all this description, what are the key points we need to look after?
Scope, route of approach,
Sorry, type of scope. Yes, sir. What type of scope they are using? Next important one is route of approach. These two parameters plays a major role in endoscopy. Yes, sir. Type of scope and route of administration. Next one, make heading laparoscopy. Laparoscopy. Leparo means abdomen. Leparo means abdomen. Scopy means visual examination. Leparo means abdomen. Scopy means visual examination. Now write down key terms. What are the key terms they will use for laparoscopy procedure? First key term, lap band. What is the key term they will document? Lap band. Lap band. Second key term,
Sorry, it's lap.
lap band. B-A-N-D band. Lap band. Next key term, port. P-O-R-T-S. Ports. If the verbiage ports is documented, then it's a laparoscopy procedure. Port. Port. Third one, robotic assisted. Robotic assisted. Robotic assisted. Robotic assisted procedure. Next one, percutaneous endoscopy on abdomen. Percutaneous endoscopy on abdomen. Percutaneous endoscopy on abdomen. What are the key terms for laparoscopy?
Lap band, port, robotic assistant procedure, percutaneous endoscopy, and abdomen.
Okay. Next one, open procedure. Open procedures. Key term is incision. Open procedure. What is the key term? Incision. Incision. Now these are the differences that we came across mostly in digestive system and genitourinary system. Why? Because digestive organs and genitourinary organs are present in abdominopelvic region. Abdominopelvic region, and these are the body parts present in abdominopelvic region. All come across these three procedures. Either they can perform with open treatment, they can perform with endoscopy treatment, or they can perform with laparoscopy treatment. What are the key terms for laparoscopy? How sometimes they may document clearly as a laparoscopic procedure. Otherwise, they may use the term lap band or sometimes ports, sometimes percutaneous endoscopy and endoscopy, like that. These are the different key terms they may use. Next one, apart from this one, for endoscopy, what are the key terms we need to look for? Type of scope, rigid or flexible. Next one is route of approach, natural opening or artificial opening. Those are the two key terms. If these are not stated, directly physician is cutting and opening and doing, that is nothing but incision. That is a treatment for open. Understood everyone? Is that clear, the differences between these three? Differences between these three? Just check those three differences. Endoscopy, laparoscopy and open.
Sir, in endoscopy, the scope will enter through the mouth.
Mouth, rectum, nose, these are all natural openings.
Okay.
Artificial opening means they will create a hole. Stoma. Stoma means artificial opening. Stoma. Understood? Stoma means artificial opening. Now, can you see question number 30? Can you tell me what is the approach used to remove that gallbladder? Question number 30 on my screen. What is the procedure doing by the physician?
Cholecystectomy.
Laparoscopy.
Cholecystectomy.
Laparoscopy.
Okay. Now you can see, you can do like this. What is the body part? Gallbladder. Cholecysto means what? Gallbladder. What they are doing, they are removing the gallbladder. Then what is the approach? Laparoscopic approach. Understood everyone? Understood everyone? Can you see question number 34? Can you tell me what is the approach here?
Proctor sigmoidoscopy.
Question number 34, what is the approach here?
Proctor sigmoidoscopy.
Endoscopy, sir.
Endoscopy, laparoscopy or open?
Endoscopy.
Laparoscopy.
Laparoscopy. Shobha, laparoscopy, Vobiyesh here.
Endoscopy, sir.
Endoscopy. Endo means within. Which body part they are examining? Procto. Proctosigmoido they are examining. Procto means what? Rectum and anus. Together what we call it as procto. Proctosigmoidoscopy. See, if they have to document laparoscopy, what are the key terms? They may document laparoscope, ports, lap band. This is the verbiage. If this is the verbiage is not documented, then that's not a laparoscopy procedure. Understood?
Oh, yes, sir. Yes, sir.
Now see the question number 38. 38. Is this procedure performed with laparoscopy, endoscopy or open? Question number 38.
Open, sir.
Open.
Incision.
Understand everyone. See, like this we need to understand the question that we will practice by tomorrow. Please go through that anatomy and terminology of digestive system and generative system. Take few questions from eye and ear chapter to practice at home. Mark the question numbers that I will discuss tomorrow. From eye and ear, mark the question numbers. Question number 12. See, mark the questions to practice at home. Question number 12, 20, 21, 25, 25, 25, 35, 37, 38. These questions practice at home so that you came across all the topics in eye and ear. Whether you are able to do it or not, you need further explanation regarding anything that we came to know. Understood everyone? Please practice at least these questions at home. Tomorrow we are going to start with digestive system. Parallelly, I will complete genitourinary system. Why? Because both are parallel concepts. Endoscopy, laparoscopy and open. Okay. Any questions from today's session?
Hi, sir. Little bit doubt.
Yes, yes.
For spinal.
Yes, sir. Yes, Sunil.
Disc herniation for preoperative diagnosis is preoperative disc herniation for radiculopathy in lumbar region.
Okay.
And stenosis also doing.
Okay. Both.
But 630 both ICDC is given in preoperative diagnosis.
In post-operative?
Also same.
Same. Okay. Okay. Now what's your doubt here?
Can we go 63030 or 63047?
See, it's not like that based on diagnosis, Sunil. It is based on the procedure performed. Even 63047 is also for stenosis.
Okay.
Okay. Then you can compare the two ports. Their only hemilaminectomy is performed in 63030. Partial portion of the lamina is removed.
Okay.
Okay. And then there is a partial vasectomy. Here, if you see the code description, And one more thing is the difference is lateral recess stenosis. The key difference between 63030 and 63047. Okay.
Okay, sir.
Based on lateral recess stenosis decompression is going on. With removal of lamina of facet foramen, you can code with 63047. It's not based on diagnosis all the time. Okay.
Okay, sir.
Any questions? Any questions from your end? Anyone in the class? See, right now in the market, those who are certified, they are like hotcakes in the market. Okay, they are getting immediately job. I don't know whether you are practicing or not. First, practice the individual papers. That what I am sharing on my screen. Be perfect in chapter wise. Then you can do mock papers. This is the perfect preparation for an examination. First, go through the notes wherever I am telling the key terms. Then go with the questions. Go with the practice papers. Try to give some time for practice. Those who want to write certification. See, without certification, you are getting a job, but you are getting confirmation after 3 months or 2 months. Again, they are performing a test based on assessment. They are releasing the offer letters for you all. If as a fresher, once before writing the examination, if you are clearing the examination, huge openings are there in the market. That depends upon you. Okay. Please try to utilize this course. Practice the sessions, practice the question papers, what I am giving for you all. We will discuss once I completed the theory part. You can start preparing for the examination oriented. How many of you are willing to take the examination? At least 10 members in this batch.
Yes, sir.
See,
Yes, sir.
if you join as a fresher also, you need to write the examination. If you are not having any financial problem, you just take the examination. Try to invest, try to practice, and you can write the examination. The people who are having little bit financial problems, then you can go and join as a job. After that, you can write the examination. Anyway, in this course, in this field, you need a you must be a certifier. Okay, that is sure. This time or later the time, what will be the time? But anyway, people who are willing to take the examination, please practice. Okay. The people who are not willing to take the examination, just you can attend the interviews. Why? Because in interview they will ask only anatomy and ICD that I already completed for you. Don't waste your time.
Sir, how much will be the exam fee?
That you can discuss with admin person Vishnu. That right now I'm not sure about it.
Oh, okay.
Any problem? See, you are having some age is 32. There is all, so there are n number of routes to get a job. That all you will discuss with admin person who is having age is more greater than 30, like that. There are n number of problems now in the market to get a job. Okay, n number of routes to get a job in the market. You can discuss with him. Thank you, everyone. Please practice those questions. Any other questions? Why? Because we almost at the end of the course. Hardly 10 sessions will be there. That means 10 to 15 hours classes will be there. That we will complete all these topics for you. That's what I am saying. Thank you, everyone. See you tomorrow. Tomorrow I will complete 40,000 series for you.